Hey there, Dr. Luke here, and let's go through our internal, external rotation hip class, functional range conditioning. So let's get to it. Okay, hip CARs, breathing in and irradiating, flexion, abduction, internally rotate, extending back, trying to make the biggest circle possible. Trying to make that movement only from the hips. I'm using a balance stick to help me with this one, but you can hold on to a wall, or you can do this one lying down or on all fours. There's some variations that you can do. Slow and controlled, search for what space that you have control over and that you have ownership over. I'm aiming for 6 reps both sides. This is my last rep. Great, other side. Breathing in and irradiating. Increasing your intra-abdominal pressure so that you can have a good foundation for your working joint to move around. And explore that biggest circle possible. Last rep, but best rep. Slow and controlled, finding for that best possible space. Great, aim for 6 on your right side, 6 on your left side. That's our hip CARs. All right, we're gonna set up into our external rotation base using our wall. My external rotation active range is about there. So I want to position my sit bones in a position that I can comfortably get a stretch and good lines of tension through that hip. So let's start my 2 minutes. Bring my hand on my knee and into my foot, and let's do a 2-minute stretch here. Really important that this is in the pain-free range. We're going to feel tension as we stretch, but we don't want any closing angle pain. Our PAILs contraction is going to be pushing my ankle into my knee, and I'm going to use my hand to give me that input of what I need to be doing, pushing more into internal rotation. And then my rails contraction, I like using my hand here so that I know that I'm going to be pushing my ankle, trying to make my ankle lighter off my knee and pushing the other way. Just gone up to 1 minute. We've got another minute of a stretch. Just relaxing into that stretch. Breathing in through our nose, out through our mouth. Our exhalation should be twice as long as our inhalation so that we can get into that parasympathetic mode. Stretching can be a bit fight or flight, so we want to try and balance that through our breathing. Great, another 15 seconds and I'll count you in for your first PAILs contraction. 3, 2, 1, and contract, pushing into internal rotation, Really building up to your best effort here. Keep going, keep going. 3, 2, 1, and opposite contraction. We're trying to lift our ankle off our knee or make it lighter. Keep going, keep going. 3, 2, 1, and relax. Recovery mode. Getting into a better stretch if we can. Finding the line of tension and holding it there. Great, 45 seconds here. And just try and relax and do your breathing. Great, coming up to a new PAILs and RAILs contraction here. 3, 2, 1, pushing your ankle into your knee, going into internal rotation of your hip, building up to the best effort, maximum contraction here. Keep going, keep going. 3, 2, 1, opposite contraction. Now pushing your knee up into your hand here, trying to lift your ankle off that knee or make it lighter off that knee. Keep going, keep going. 3, 2, 1, and relax into that last recovery mode. If you do have an injury through this hip, or you have quite significant degenerative changes, we want to decrease the intensity of that contraction first of all. But we want to build up to your best effort when you can and you feel safe to do so. Great, we're coming up to our 45 seconds. Three, 2, 1, and just coming gently out of that base. Now what I want you to do is a capsular cars, keeping your knee nice and straight. We're going to internally and externally rotate the knee. Only moving from the hip. Giving your nervous system that information and your joint capsule information it needs to get the most out of that deep stretch that we do to open up more space there and spatial awareness. Good, squeezing out into that internal rotation, holding, keep holding. Really squeezing that internal rotation. Another 5 seconds. 5, 4, 3, 2, 1. Going into external rotation. Squeezing as much out of external rotation as you can. Good, another 5 seconds. 5, 4, 3, 2, 1. And relax. Okay, now we're going to do the other side. Going up into our base there and switching on our 2-minute stretch. Great, just find the best possible stretch in our external rotation. I need to come closer to the wall here. I've got a little bit more range of motion on this side. Okay, making sure that we're trying to get and focus the stretch through that hip joint and not the lower back. Good, concentrate on your breaths. Breathe in through your nose, out through your mouth. Another 30 seconds, and then we'll go into our PAILs and RAILs. Best effort contraction and safe contraction. You be the coach on what you can do and what your intensity should be. Okay, 5 seconds. 5, 4, 3, 2, 1, and contract, pushing your knee or your ankle into your knee. Build up to best effort. Keep going, keep going. 3, 2, 1, opposite contraction. We're trying to make our ankle lighter off our knee. Keep going, keep going. 3, 2, 1, and relax. Trying to get into a better stretch there. And 45 seconds here. Again, just recovery mode here. Great, 3, 2, 1, and PAILs contraction into your knee. Building up to best effort contraction. Really put that intensity on. 3, 2, 1, opposite contraction. Really push here. Keep going, keep going. Best effort. Trying to bring your knee, your ankle off your knee and relax. Going into a 45-second stretch here. Okay, recovery mode. Okay, coming in the last 5 seconds and coming out of that base. And now what we want to do, we want to do our capsular cars. So we want to go into internal and external rotation. We just want to be pivoting through that knee and that hip, and just moving the hip into internal and external rotation. Slow and controlled, squeezing out as much internal and external rotation as we can. Okay, and squeezing into external rotation. Holding it for 15 seconds. Another 5 seconds. 5, 4, 3, 2, 1. Going into internal rotation, squeezing that out. Another 15 seconds here. Really trying to contract. And 5, 4, 3, 2, 1, and relax. Fantastic. Now let's go into our internal rotation base. We're using a block between our legs here, and we're going to be just creeping our feet up into our internal rotation stretch here. And we're going to start our timer. Great, so position yourself close to the wall if you need to, but find our stretch. Squeezing into that block and feeling the stretch I can feel it into the anterior part of my joint capsule. And nice and relaxed, let yourself get into that deepest stretch as you can. If you feel you need to move your feet and kind of creep into a deeper stretch, you can. Our PAILs contraction for this one is trying to pull the wall together. We're going to use the wall as that resistance to get our isometric contraction. And then our rails contraction, we're going to be trying to pull the wall apart, keeping our feet planted on the wall, but trying to pull it apart and going into our internal rotation PAILs, rails. So another 2-minute stretch. So remember, our starting stretch is always 2 minutes, ideally. Okay, we've got another 15 seconds or so and I'll count you in. We're going to do our PAILs contraction, which is going to be trying to squeezing and pushing the wall together using our feet, but keeping everything stable. So 3, 2, 1, breathe in and irradiate and contract. So we're contracting into external rotation. Really building up to best effort here. Keep going, keep going. 3, 2, 1, opposite contraction. We're trying to pull the wall apart, going into internal rotation, increasing that internal rotation. 3, 2, 1, and relax. That's going to be the hardest contraction, that rails contraction there. Sometimes it can be a little bit crampy. So going into recovery mode, relax everything and trying to get a different stretch if we need to. Just find a stretch in the line of tension. Great, another 10 seconds and we're going to do another PAILs and rails contraction. So breathe in and irradiate. 3, 2, 1, pushing the wall together, going into our external rotation. Contraction, pushing really hard, best effort. Keep going, keep going. 3, 2, 1. And relax, going to the opposite contraction into increase internal rotation. Contract really hard. Keep going, another 5 seconds. 3, 2, 1, and relax into that stretch. Recovery mode now. And find the best possible stretch there in line of tension. Good, another 5 seconds and we'll come out of this base. 3, 2, 1, slowly coming out, moving away from the wall, bringing that yogic block between our legs, and now we want to just go into internal rotation. Squeezing that out, 10 reps. Okay, last contraction. Hold 15 seconds here. Really squeezing out that internal rotation, contracting. 3, 2, 1, and relax. And coming out of that. Fantastic. Now we want to end with our hip cars. So let's get into that position there, laying on our side. We'll do this one on our side here. Get into the best possible position, arms out front, breathe in and irradiate, coming up and around, internally rotating and extending. Externally rotating and coming back into that neutral position. So that's 1. We want to do 6 reps on each side. Two. 3. 4. 5, last rep on this side. Great, and now we want to turn and swap sides. Breathing in and irradiate, going to hip flexion, around internally rotating. Asking yourself, what movement do I have control over? And what movement do I have seeing if we feel that we've got increased range of motion after our PAILs and rails and internal external rotation. Great, and last rep, coming back. And ending there. Fantastic. So that's our internal, external rotation class, PAILs and rails. So give it a go.